Okay, I think we will get started then. I think a few more people will be joining, but we'll start now and feel free to carry on doing the poll. Okay, so hi everyone, welcome to this Sahiyo India event, How to Stop the Rising Trend of Medicalising Female Genital Cutting in Asia. My name's Beth, I'm a programs intern currently with the US side of Sahiyo, that this is in connection with the India side. Okay, so this panel features experts in female sexual and reproductive health, talking about this issue of medicalisation, how can we stop it, and why does it need to be stopped? Firstly, I'm going to give a brief overview of what female genital cutting itself is, and then what this medicalisation of FGC is. Just a heads up, I'm going to be referring to female genital cutting as FGC throughout my introduction, and other speakers may refer to it as FGC2 or FGM or FGMC, just to let you know. So, what is FGC? WHO defines FGC as all procedures that involve partial or total removal of the external female genitalia or other injury to the female genital organs for non-medical reasons. It's important to stress that there is no medical benefit for this procedure, no health benefits, nor is there any religious basis. Kate, would you mind moving the slide on? Thank you. So there are 4 types of FGC, all involving some sort of cut to or removal of genital tissue. They are all associated with severe health risk, and the risks increase with the increase in severity of the procedure corresponding to the amount of tissue that is damaged or removed. So short-term and long-term complications of FGC include, or can include, extreme pain, hemorrhaging, genital tissue swelling, urinary tract problems, infections, as well as childbirth complications, sexual problems, HIV, menstrual problems, and various different mental health problems as well. This is just an overview. The impacts of FGC on survivors are hugely wide-ranging and depend on each individual experience. The practice is mostly carried out by traditional circumcisers or cutters, who often play other central roles in communities. However, in many places, healthcare professionals perform FGC due to the very misguided belief that the procedure is safer when medicalised. So FGC is recognised internationally as a violation of the human rights of girls and women. It reflects deep-rooted inequality between the sexes and constitutes an extreme form of discrimination against girls and women, as well as being a violation of the rights of children. The practice also violates a person's right to health, security, and physical integrity, the right to be free from torture and cruel, inhuman, or degrading treatment, and also the right to life when the procedure can result in death. There are many multi-layered reasons for why communities perform FGC, from it being a cultural tradition to conformity and fear of being ostracised. FGC is also motivated by beliefs about what is acceptable sexual behaviour in girls and women, associated with cultural ideas of femininity and modesty. And in some communities, it's believed to uphold virginity, stopping premarital or extramarital sexual activity. If you would like to know more about the causes and consequences of FGC, please visit Sahiyo's website to learn more. It's sahiyo.org, and we've got lots of blog posts on there from survivors and just lots of information about the practice. So 200 million girls and women alive today have undergone FGC, and this number is likely a lot higher. Around 1 in 3 adolescent girls who have undergone FGC were cut by a health professional, and more than 3 million girls are estimated to be at risk for FGC annually. FGC is practiced in 92 countries across the world, across Africa, Asia, the Middle East, and within diasporic communities worldwide, with the prevalence and type of the practice varying among different countries and regions. If you have a look at what I've just shared here, this is kind of a summary of the prevalence of FGC in Asia. So some of the countries we're going to be looking at specifically today, where our speakers are from, is India, Indonesia, Malaysia, and Singapore. So just a quick summary, India has not put in place any laws or policies on FGC, despite evidence of its prevalence in the country, and it's failed to acknowledge that it even exists. This has allowed the practice to persist in secrecy. It's widely referred to as Khatna and is performed widely within the Dawdi Bora community, with a recent study reporting that 75% of Bora girls have been cut. And then in Indonesia, with over 49% of girls between the ages of 0 and 14 having undergone FGC. It ranks third in the world for the rate of prevalence of FGC. The practice has also been medicalised extensively, with over half of all FGC cases in Indonesia being carried out by a medical professional. And FGC is also legal in Indonesia, and efforts to end the practice have been minimal. According to a recent study by UNICEF, an additional 15 million girls in Indonesia will be cut by 2030 if efforts to stop the practice aren't increased. So in Malaysia, the Malay term for FGC is sunat perempuan, which literally translates to female circumcision. There is no official data regarding the prevalence of FGC in Malaysia, although reports indicate that type 1 and type 4 are the most common types of FGC in the country. And a recent study has reported that 93% of women in Malaysia have been cut. There are no laws against FGC, and there is currently rapid medicalisation taking place. FGC has been a long-standing practice within Singapore and is especially prevalent in the Malay community. There is no law or legislation banning FGC, and there is a current lack of comprehensive and authentic data. Previously, the practice was performed by traditional midwives at home, but it is now largely conducted at private medical clinics by female doctors. So, what is medicalisation? As defined by WHO, medicalisation refers to any situation in which a healthcare professional plays a role in the practice of FGC. To justify this medicalisation, it is argued that the use of medical equipment can reduce harm caused on girls and women undergoing the practice. As you'll hear in this webinar, there are many reasons why these arguments are wrong. And there is no justification for FGC, regardless of who carries it out. And the medicalisation not only underplays the threat posed to life and well-being of girls and women, but also hinders international efforts to stop FGC. So on to the speakers. Unfortunately, I'll say first, Anjali Nayar is ill, so is unable to join us, but we still do have our 4 speakers with us today, so it should be still very interesting. So firstly, we have Saza Faradilla, then Kalpana Swaminathan, Ibu Atas, and then Dr. Nozer Sheriar. And we were moderated by Insia Darawala, who is a co-founder of Sahiyo herself. So firstly, please see the link. I'm just about to put a link in the chat, which will give the bios of each speaker. If you would like to know more about all these different speakers, please have a look at this link. I'll just put that in the chat. Okay, so firstly, before I pass on to Insia and we start our discussion, we are going to watch Saza's Voices to End FGC video. So Saza is a FGC survivor herself, and in correspondence with Sahiyo, she has kind of retold her story and put it on to a video platform to raise awareness and kind of start discussions about it. So we will play that now and then we'll go on to the discussion.
Saya berdiri di tepi jalan, memakai pakaian ringkas, kemeja T dan seluar jeans, menunggu ayah menjemput saya dari universiti. Kami sedang menuju ke rumah ibu saudara untuk acara ulang tahun sepupu saya Anissa yang berumur 2 tahun. Assalamualaikum, saya ucapkan semasa memasuki kereta. Ibu bapa dan kakak saya membalas, Waalaikumsalam. 20 minit kemudian, kami tiba di rumah ibu saudara. Dan terus terbau aroma masakan rendang, lodeh dan sambal goreng yang enak. Rumahnya penuh berwarna-warni. Daripada baju kurung merah dan biru kepada jubah hijau dan juga abaya hitam. Saya mengambil makanan untuk ibu dan diri saya. dan kami duduk sambil menikmati makanan lazat. Makcik saya membawa sepupu saya yang comel dan dengan bangganya berkata, "Dia disunatkan minggu lepas." Mata saya terbeliak. Tulang belakang saya menjadi lurus. Saya hampir terjatuh dari sofa. "Dia disunat? Anak perempuan disunat?" saya bertanya. Saya tidak boleh percaya jawapannya. "Ya, minggu lalu oleh seorang doktor. Cepat sekali." "Snip, dah habis pun," makcik saya menjawab. Tetapi ini melanggar hak kemanusiaannya. Ini salah," saya menjerit. Kakak saya memotong perbualan kami. Dia berkata, "Kamu juga disunat semasa kamu kecil." Mulut saya digantung terbuka. Itulah saatnya saya sedar tentang sunat perempuan dan saya mendapat tahu ia telah berlaku kepada diri saya. Tetapi, mengapa? Untuk apa? Saya menanya ibu. Ibu menjawab, dalam Islam, perempuan patut disunat. Cara ini lebih bersih. Dan kamu tidak akan berzina. Pada saat itulah, saya memutuskan untuk mencabar mitos-mitos sebegini dan melindungi anak-anak perempuan lain di Singapura. Dan sejak itu, saya telah berkempen untuk menghentikan amalan sunat perempuan.
So thank you very much, Saza, for giving us permission to show this. I think it's really useful, firstly, to hear a story from the survivor themselves, but also for us to see, for everyone to understand how it can happen and there's just such different experience that survivors can have. So I just would like to say before we start that this is a sensitive and potentially triggering topic. So we do encourage people to take care of their mental health and take a step back if need be. So now I'm going to pass on to Insia, who's going to moderate.
Thank you, Beth, for leading this. And I agree with what you just said regarding Saza's video. It was extremely heartfelt. And as we, as activists, we have seen a lot of survivors have come out with their stories, and it's extremely heartbreaking to see how it has impacted them, because a lot of times they don't know what was done to them or if it was even done to them, right? And so I think the discovery itself is very traumatic. So Saza, thank you so much for sharing your story with us over here and with everyone who's present. And I just want to thank all the panelists and also the audience for taking out time and joining us and supporting us on this cause. It is a topic that is not really talked about as much as it should be talked about. And as we all know that in India, we do not have laws. We in fact don't even have any acknowledgement of the fact that FGC is practiced in India, within the Abora community. So I'm just going to dive in and start with Saza. Saza, medicalization in Singapore is normalized. As per the medicalization of female genital cutting in Malaysia, a mixed method study showed that 20.5% doctors practice FGC in Singapore, out of which 89.4% performed FGC on girls before their first birthday. The preferred age for the cut was 4 to 6 months. Now, you yourself at that time felt that it was a better practice, to have medicalization of FGM, and you felt it was safer at that time, but now you don't feel that way. Can you tell me what made you change your mind?
Thanks, Insia, and thank you, Beth, for the introduction and for setting the context as well. Thank you to all the speakers who are here too, because I'm so honored to be in the company of such esteemed healthcare professionals and experts. So My name is Saza. My pronouns are she and her, and I come from Singapore. Maybe I'll just share a little bit more about how exactly medicalization is done in Singapore, and then kind of my journey as a survivor and how I came to change my mind about medicalization. So medicalization in Singapore happened rapidly in the past 20 years. So Singapore is a little red dot that was modernized very, very quickly after 1965. And with that came a lot of maybe ethnocentric values or Western values of hygiene and sterility. And because of that, FGC became something that was medicalized. And so today it's done in the doctor's clinics. And it's done by a professional healthcare professional. There are about 6 of these clinics around the island, and only female Muslim doctors do it. It is something which the Ministry of Health has closed one eye on. They choose not to acknowledge it. Recently, because of our activism, I should also mention that I'm a co-founder of End Female Genital Cutting Singapore. I'll drop the link later on in the chat. But basically what we do is we advocate for female genital cutting in Singapore to end. And our vision is to end it within the next generation. So where was I at? So I think the medicalization of it, so it's done by 66 doctors, and you pay about 50 Singapore dollars, which I think it may be about 35 USD. And it's very, very fast. It's you do it for 5 minutes and that's it. So you saw from my Voices video that I found out about FGC that was done onto me when I was 20 years old. So only as an adult then I found out about it. And I think this really speaks to the aura of silence, of the fear of female sexuality. And so that's why it was something that was never broached in my life. And I was actually cut by a traditional midwife because I was born in the 90s. So it was the traditional midwives were still the people who were doing it. And it came along with ear piercing also. And so they used the traditional needle to pierce my ears when I was a baby. And upon finding out, I felt very, very violated. I felt very angry with my parents. I didn't accept their reasons for it because they are essentially flawed. And then I started writing a lot of papers in it. So I found out when I was in university. So I wrote about 5 academic papers, did a performance art on it to try to kind of process my feelings about this. And then we started End FGC last year, 2 years ago in November 2021. And so we celebrated our first birthday recently. And so you can find us on Instagram. And we conducted a pilot study, the first ever of its kind in Singapore, to find out exactly the prevalence of FGC in Singapore. And what we found was that 75% of Muslim women have been cut. And so this translates to 120,000 people in Singapore, which is a huge number, and it still continues to happen. And the reason for it happening in Singapore is that there's just a lack of critical thinking about it, a lack of questioning about it, and the misplaced belief that it's Islamic and that it's for hygiene purpose. So typically a mother would, upon the guidance of her own mother, would bring her newborn daughter to the doctor's clinic and get it done. So when I started my bachelor's thesis on this topic, I witnessed circumcision happening. So I went to the doctor's clinic to interview the doctor. And then at that time, there was a request for a circumcision. And she asked the mother if I could view it, and the mother said yes. And so I did. Today, I regret not stopping it. But where I was at that time when I was 20, I was just keen to see how it was done. And so what it was right now is that the doctor took a pair of scissors, so very similar to these, sterilized it, and then she took off the diaper from the baby and she snipped off a part of the vulva. So a baby's vulva is extremely small, right? It's 1.5 cm. So any amount that's taken is significant. But the doctor brushed it off. She showed the cutting, this piece of skin. So she showed me it was on a little part here. And she said, you see, it's so small, it's smaller than the tip of a pen. And she does not kind of understand any of the mental or psychological impacts that we now know about FGC. So that incident, and also when I also interviewed the president of the Muslim Healthcare Professionals Association, who told me to stop my research because he said it would stir up a lot of Islamophobic Islamophobic sentiments. So all of these medical professionals and experts kind of convinced me that medicalization was safe, or that it was something, at least it was better than doing it with the traditional midwives. And that is what we've been kind of advocating for in NFGC as well, is to increase regulations surrounding FGC. So what we've suggested to the Ministry of Health, and we've done reports for them, is to treat it the same as any other operation. So for instance, a tongue tie surgery for a baby, if the little there's a little thing under our tongue, if that's too tight for the baby, they cannot suckle. So the mother would need to give consent for that, would have to sign something, would have to wait 24 to 48 hours, and the doctor would explain everything about the procedure. So we thought that is harm reduction, right? Chances are, once people understand that this procedure is unnecessary in Islam or in the Malay culture, that they would not do it. Because Singapore in general is a well-educated populace. So we believed in kind of the maturity of the community. Recently though, there was a study in Malaysia about the medicalization of FGC there, where they interviewed over 200 doctors. So, what they found was that, so I just dropped it there, the doctors were actually doing type 1 FGC, while the traditional midwives were doing type 4. So type 1 is when there's any nicking of the clitoris or clitoral hood. Type 4 is any sort of genital modification. So type 1 is more severe than type 4. And they found that out. So, and I think the problem is just that even though FGC is medicalized, even though it's observably medicalized, the issue is that doctors have never learned this, and they shouldn't, right? It's not in any medical journal. It's not taught in any medical school. So that very fact means that the doctors have no idea what they are doing. Even if they are healthcare professionals, they don't know what they are doing at all because they've never learned it in school. So I think that's the reason why the cutting becomes worse when it's done in the hospitals and in the clinics. So today, the stance that NFGC takes, we are in a little bit of a paradox, right? If FGC were to still continue, if the Ministry of Health were to still endorse this practice by not actively calling it out and stopping it, then how do we make it safer? At least for the baby girls that are being born today. And we don't really have the answer. I think we're trying to work on all fronts. So we are working with the community to help the community understand that this is unnecessary and that there are mental and psychological trauma that can happen to the children. We're trying to work with the political office holders to ask them to come up with stronger rules and regulations, and eventually to stop all forms of FGC in Singapore. And then to work with the religious leaders as well, to get them to help the community understand that this is not Islamic. So we're trying to do all of these kind of in tandem. And we hope that once one generation stops doing it, because in Singapore, the religion, especially Islam, is very tightly controlled. It's the only religion which has a statutory board. So the government surveils it very much. The government polices it a lot. So I think once one generation stops doing it, there will be collective amnesia, and there will be structural change around the practice, and it will not be done. So our job now is to continue campaigning for the next 80 years, and then just stop one generation from doing it. I think all generations will stop doing it. And I have to say that, my experience is very specific to Singapore, right? In other places where FGC is much more severe, then I think no way medicalization, even increased regulation, would not be helpful. But I think in Singapore, this is the situation that we are in right now, and this is what we think is the best way forward. Yeah, that's all.
Thank you so much for sharing so extensively. And I just want to put it out there, listening to whatever Saza shared regarding witnessing a doctor performing, it impacted me just now. It kind of disturbed me. So I just want to put it out there, and it's again a trigger warning that we are discussing something that is extremely sensitive. It can, bring back a lot of memories. So please protect yourself emotionally, and please feel free to step back. Unfortunately, we will have to continue because this is exactly what we are here to discuss. But Saza, I want to ask you one more question. Listening to you talk about the fact that, the doctors don't even know what they are doing, right? I mean, cutting the vulva is not what FGC is touted to be. So what kind of, backlash do you get when you talk about, because you are obviously not just talking about you're against medicalization, but you're also talking about ending FGC. So do you face any kind of backlash in your community, or is there any kind of acceptance for the fact that, okay, we need to change, or we need to revisit this and see if it can be stopped, or is there any need to do this or continue this practice?
So NFGC's stance has always been that we don't believe in the banning of female genital cutting. Firstly, because I think using the criminal justice system further on an already minority community in Singapore would harm the community more. And secondly, also that banning it all around the world has proven that it still does continue. It goes underground. So what we really believe in is community re-education. So we have faced a lot of backlash. I think especially when we touch on religion, when we did a panel for on religious speakers who spoke out against FGC or provided more diverse perspectives on it. There was a lot of backlash from the religious community and from other religious leaders. Till the point, it was very intense, I think, on our social media. And recently, in October, also for the first time, FGC was brought up in Parliament by an opposition member of Parliament, and we helped to kind of craft that speech for her. And we talked about how we want it to end, we want increased regulation, and that also led to a lot of backlash amongst the conservatives. But I think that this discourse is absolutely necessary. I mean, drawing the larger picture, I think in Singapore we've not been taught how to have civil discourse, simply because a lot of things you just cannot say. So I think starting civil discourse, starting public discourse is an extremely important step forward for ending FGC, because when people are talking about it, they're at least acknowledging that it happens, and acknowledging lived experiences. And then the next step would be to then kind of tell people, how do you increase your critical thinking in relation to this topic, and then also to other topics under patriarchy and neocapitalism, which is all tied to ending FGC as well. Yeah.
Thank you, Saza. Thank you. And this takes me to Dr. Kalpana now. Doctor, in 2019, you were on the panel at the Sahiyo's Faces for Change exhibition with survivors. And you had made a statement that has stayed with me, and it will stay with me for the rest of my life, which is, it takes 100 years for a child to forget a bad touch. And that somehow, impacted me and made me sad, actually, because as a survivor, it kind of made me feel hopeless. So I just want to ask you now, listening to Saza, and, being that we are here and you have met survivors before as well, I want to ask you, and I saw you do this when Saza was talking about, the scissors cutting the child. I want to ask you, would medicalization be a better option when it comes to FGMC on a little girl? You have to go on, you're on mute right now.
First, before I answer your question, let me just take a minute to say how terrific Saza's presentation was, because the things that her little video showed was so much more important than even the point she made later. And I refer to the feeling or the background of normalcy against which she has chosen an extremely dramatic contrast between the joyous occasion of celebration and the incidental mention and the discovery and her own moment of understanding that she has been violated and she has forgotten that violation. Now, that is a point I think every survivor of FGM must have experienced at one point or the other. And following which, the approach which she has outlined when she was looking at it was extremely interesting because first, let me start with her witnessing the operation, and let me relate Saza's narrative to your question before I supply my own opinion to that. You asked whether it would be better to medicalize the procedure. Now, the word medicalize is a horrible word in this context because you have Beth described it according to WHO. It simply means the presence of a health care professional with maybe not aseptic conditions of an operation theater, maybe not anesthesia, maybe not restraint. That's medicalization for you. All it does is to carry the procedure from your own kitchen or your living room or maybe the person's area to an impersonal, strictly controlled area. The procedure and the injury remains the same. And then the arguments that Saza presented about no doctor being taught how to do this procedure, etc., etc. The validity of that statement is, well, yes, the statement is factually true, but the validity goes a little beyond that fact. So I am by training and profession and a long period pediatric and neonatal surgeon. So I'm used to dealing with the bodies of infants and newborns. And only I make this comment to tell you that yes, size matters in that little baby. There is no place where the kind of thing that Saza described, pick up a pair of scissors, snip, and get on with it, and show it at the tip of it was a horrific narrative. And if this is what is called medicalization, it's much more horrific than what a guy or a person who's technically trained or just the usual, as you call, cutter does it. However, even if a qualified pediatric surgeon used to neonatal surgery were to do this procedure, it would still be just as horrific. Now, the fact that it's objectionable is at several levels. And now, because I'm not at this moment empowered to speak about the social and religious context, I'm leaving that out. I will talk about what relates to the body of the child only and only to the body of the child. Now, why would it be wrong? Actually, I'm going to reverse that a little bit and ask you guys a question, which is this. Now, supposing I, as a mom, got this procedure done on my daughter with no religious or cultural background to the necessity for this procedure. Okay, supposing X person takes her 2-year-old daughter to be, as you call it, cut. I don't very much like the term because it trivializes the procedure. You take her for this procedure. How would you view this person who has no cultural or religious necessity to do it? She's not informed by her cultural background that this must be done. And yet she does it. How would you view it? Would you not view it then, without question, as an injury to the child? Would you not view it then as sexual trauma to the child? Would you not view the parent then as an uncaring, even cruel parent? Would you not view the doctor then as some kind of monster? You probably would. All these extreme descriptives that I have just given are erased at once by something which says culture, tradition, everything is good. So then, if that is so, if that erasure happens so easily, because you feel the compulsion, the cultural pressure, which is of course the very motive of religion and culture, which is to stop you thinking from as an individual and make us think as a herd. So the first thing that I would suggest is that it has to be viewed as a parental decision on the body of a child whom they are meant to protect. The doctor also has to view the procedure as the same. We surgeons cannot supply demand. Yes, there are some kinds of surgery, like cosmetic surgery, where it is done. Now, this is not that. And there too, personally, I quarrel with a lot of the ethic of that. But here, when you are traumatizing the integrity of a child's body for no special reason, and when you're doing it with no understanding of what you are doing. Now, here, with relevance to the clitoris, no understanding is particularly significant because it is only surprisingly very recently that the entire anatomy and the neural connection and the understanding of the clitoris is actually coming about. That means we still don't know. So to pick up a pair of scissors and snip at whatever you see may be ritualistically satisfying. But in terms of injury to the child's body, it cannot be condoned. At any point, it cannot be condoned. What does it do to the child? Innumerable things. Psychologically, yes, that is much talked about. But structurally, immediately, it can injure every part of the child's anatomy. It can not only injure.
Dr. Kalpana, I'm sorry, I'm going to interrupt you. You said we have spoken about psychological impact, but I would appreciate if you could reiterate that, because there are a lot of new audiences here who may have not heard you on this before and seen your, the previous panel. So can you please talk about how it impacts a child psychologically, even in the long run? Because I think that is something that we need to address. It is not just a physical act, it's also a long-term memory that is impacting on many different levels, including, your adult relationships, your intimate relationships. So can you please talk about that?
I will just mention it because I think there are people more experienced than me who deal with adults and who deal with this, who will be able to speak about the long-term effects, but about the short-term effects during childhood, I'll certainly tell you what little I know. Any child who undergoes sexual trauma shows a degree of disturbance, which very often cannot be related at all to anything sexual having happened to the child. For instance, any child who undergoes even inappropriate touch may suffer from things like nightmares, doing badly at school, being just afraid, being unable to trust. These are things that we pick up when we deal with children who have problems in school, problems on the playground, or who appear disturbed. Now, I'm not saying, the answer which I get usually when I make this observation is that, as you quoted the figures, 100 million women or however many million women are like this, and none of them are disturbed. They're all fine psychologically. My answer is, how do you know? You don't know. No, as a surgeon who has operated on children for other problems, I know that even when a child understands a surgery and accepts the fact that she or he is ill and requires surgical treatment, surgery does cause an immense trauma to a child. Now, sexual trauma is associated with a lot of other things, including identity problems, which a child is going to experience, especially as she reaches her teenage years and adolescence. So very often when a child becomes aware of a previous injury, a childhood injury, at the time when sexual exploration begins, which is normal and expected and indeed necessary in a child who's attaining puberty, it can come as a terrible shock. These are not things that children will speak about. These are not things that women will speak about, which is why I am absolutely devastated and honored by the fact that so many women who have survived this procedure have found the courage and the courage to speak about it and the determination to fight against it. And this courage and this determination, I think, is simply propelled by the trauma they have suffered, an understanding of the trauma they have suffered.
I agree. Doctor, I have one last question for you. Do you see any misogynist link to this practice of FGC getting medicalized?
Of course it is purely misogynistic. What it says is, okay, look, we'll do it cleanly, we'll do it neatly, we'll do it safely, but we'll do it. We'll still control your sexuality. We still want to make sure that you're cut. We still want you to know that it is wrong to be, uncut, you see, because until you are cut, you're dangerous. And if that isn't misogyny, I don't know what is.
Great. Something that I saw in Saza's video just popped up in my head just now, where her sister told her that, they do it so that you won't have extramarital affairs, right? So I mean, yes, misogyny at its best. And thank you very much, Dr. Kalpana. I would like to now move on to Dr. Nozer. Thank you so much. Dr. Nozer, as a gynac, you have been one of the biggest supporters of Sahiyo's work in India, and you have been extremely vocal in voicing your opinion about FGC. I would like to ask you to share with our audience how, in your experience, how FGC impacts a woman's reproductive health. Just a summary of it.
Thank you. Insia, thank you. And Insia, I must appreciate your role in kind of getting me involved in this issue. And I feel there's so much more we need to do to create awareness amongst the medical profession of something we know is happening, but we believe isn't happening in our neighborhood or to our patients. So, I mean, it's great for me to speak after Saza and Kalpana, and I look after women, I care for women. I'm supposed to be their caregiver, doctor, advocate, champion, co-conspirator, whatever. I'm supposed to look out for her. I'm supposed to speak for her. And if you remember in 2018, when we had the World Congress of Obstetrics and Gynecology in Rio, which I was privileged to prepare the scientific program for, one of the things I did that I was most proud of was this one short session called Hello Doctors. It was right before the plenary lecture in Sia. You were one of the speakers, and I remember how the audience was in tears after you'd spoken about abuse and gender-based violence. But on the first day, there was this amazing young Zulu woman from Kenya. Her name was Nice Nelantel Lengete. And she stood up and spoke about FGM, female genital mutilation, to a plenary hall full of gynecologists from all over the world. Now, we generally know it's happening. We read it's happening. We know there are policy statements, but unless you hear someone stand up and talk, it doesn't hit home. And I can tell you that really hit people in that audience hard that day. She managed to escape SGM by running away from home many times. Her siblings had to undergo FGM brutally, if I may say, and until her grandfather, who was the elder in the tribe, finally said that nobody's going to touch this girl. And I wish there were more elders who said nobody's going to touch this girl. It really brought home to the family of gynecologists that FGM is not something that happens in deep, dark Africa. It's not something that just happens in Sudan. It's happening just about everywhere in the world. Now, we always thought in India, this is not an Indian problem. And I can tell you 2 weeks ago, I delivered a young Dawoodi Bora girl, late 20s, just short of 30, normal delivery, female child. And what happened was she had a very, very bad tear around the clitoris. And of course, I had to control it with sutures. And knowing what happens, I asked her, and she said that she was ashamed that she had undergone Khatna as a child. She said, this is something I will never, ever allow to happen to my daughter. And but what bothered me in Sia was she didn't know about Sahiyo. I educated her about Sahiyo. So we've got our work cut out.
Tell her about us.
Of course I did. Of course I
Okay,
did.
thank
But
you.
we have our work cut out for us. If a young woman of the community in Mumbai doesn't know about this work, who's kind of carrying the burden alone, but is brave enough to say her husband was in the delivery room with her, she immediately understood why it had happened. And she said, I'll never allow something like this to happen to my daughter. And I'm ashamed it happened to me. Then you remember Ajay Rane, my urogynecologist friend from Australia, probably one of the most renowned urogynecologists in the world. And Ajay used to tell us these experiences and stories. And he once told me how the Malaysian health minister had a meeting with him and asked him, Dr. Rane, how can we do this medical cutting safely? So here's this World Authority urogynecologist asked by the Minister of Health, and Ajay said, very simple, don't do it. I mean, it's so sad that the health minister of a country asks, is there a safe way of doing it? And can I have my doctors do it for women safely? When it's something that's so completely unnecessary. And then one thing that really hit home was, this was first post 2017, when I read about two gynecologists, two doctors in Mumbai. One of them was a well-known gynecologist, a woman gynecologist, who I read actually claimed that this is a harmless procedure that comes under religious freedom.
Yes.
They had founded, I will just quote this here, the Dawoodi Bora Women for Religious Freedom and Support for Female Circumcision.
Yes.
What freedom are you talking about when you're talking about a 6-year-old child? I mean, Kalpana did speak about procedures, and yes, we do respect personal choice. A 6 to 11 or 12-year-old child has no personal choice. So what are we talking about? Who are we fooling? They went ahead to claim that this is something that has to be endorsed, and all you do is cut off a pinch of skin from the clitoral hood of girls between 6 and 12. Kalpana said it so well. Try pinching the clitoral skin of an adult woman and see how much you get in your between your finger and your thumb. Then you may say, okay, fine, use a very fine instrument and try cutting it off. This is tissue which is vascular, if you know your anatomy. This is tissue which has a lot of nerve endings because it's sitting right next to the clitoris. And there is no, I mean, to say that type 1 is better than type 2, 3, or 4 is ridiculous and outrageous. To try and justify something as being safe and minor because the other alternatives are so brutal and archaic is ridiculous. So it's something that people just haven't. And can you understand this 6, 8, 10-year-old child being pinned down to have a procedure of something cut out from there? And then are there consequences? Well, I will tell you, I would not be able to tell you how many of these are because of FGM, but I can tell you that in my practice, I must have at least 100 women I've treated with vaginismus. People don't talk about it. Women who have not been able to consummate their marriage years after they get married, 3 years, 5 years. I've even had women up to 10 years coming back to us. Doctors
Are
don't
these
understand.
women from the community?
No. The point I'm making is an experience growing up. And most often it is going to be other kinds of abuse, but an experience growing up which hurts her, scares her, she's petrified of touch, then builds in a very involuntary, uncontrolled fear of anything local, sexual, anything. So I'm just saying the experience that if any woman can have it, how can you not have it when you've got 6-year-old, 8-year-old, 10-year-old, 11-year-old girl who's taken to a place, taken to a room, taken to a doctor's clinic, her hands are held down, her legs are forced apart, someone grabs a little piece of your skin and snips it off. I mean, it doesn't even need scientific study to know how damaging this is going to be.
So, Doctor, I'm going to interrupt you and ask you one question. We are running short on time, so I just want to ask you one question. When you spoke about the doctor that said that it was the doctor from the Bora community, which said that it's just a pinch of skin that we are talking about, what would how would you hold this doctor responsible according to the Hippocrates Oath? Because this is not a medical practice, it's a non-medical practice. So you're basically trying to medicalize a non-medical practice, and you're going against the oath which says that do no harm. So aren't we supposed to hold these doctors responsible? And if yes, then who is going to do that? And please, I mean, I'm looking at you for answers. I've always come to you for support. So we really would love to hear from you on this.
So firstly, the federal authorities in the US have charged doctors. Unfortunately, cases drag on, all kinds of lawyer games are played, but we do know that there are doctors from the community in the US who've been charged. There's this doctor from Detroit who's supposed to have even traveled other places. So that's one way where it comes against the federal law. Do you need a law for this? I think the present laws are quite enough. If someone was to get them enacted, unfortunately, it's a secrecy and a silence. What we've done, and unfortunately, you have to understand as professional organizations, there's a lot of ethical issues we deal with. You know that after we've interacted, we did come out. In fact, the first thing Foxy did was, the Federation of Gynecologists, is we set up an anti-violence against women cell. And one of the things we took up was, if we came up with a very strong policy statement against FGM, which I believe was also used when the case went to Supreme Court. And if I just quote a very small part of that statement, it said that, Foxy, that's our federation. I mean, you've got statements from the WHO, UNICEF, FIGO, the Royal College, the Canadian College, everyone. Right. So this is something all professional organizations are speaking about. At least their members should be aware that this is unacceptable. So Foxy said that FGM in any form is a cruel traditional practice almost exclusively inflicted on women, performed without individual choice or valid consent by providers, usually without medical training or qualification, because as of now, that's the situation, at least in India, makes genital mutilation a violation of basic right to physical safety and bodily integrity. It says that we acknowledge documented medical evidence, and there is enough to say that there is risk of hemorrhage, infection, shock at the time, as well as long-term physical and sexual consequences, including infertility, so much else. And finally, we direct our member gynecologists, and this is what Foxy has put out, and all other healthcare professionals to desist from performing or participating in any procedure of FGM. Any such involvement would clearly be a breach of medical ethics and go against the primary medical dictum of first do no harm. Now, this position statement stands. Is it implemented? Well, let me be honest, unfortunately, no. All these medical organizations can put out all the statements they want. Our members don't really have to bother about what we say. They completely function. This has to be a case for the authorities. This has to be something someone reports to the medical council, and then there is enough evidence to say they shouldn't have done it. But unless and until this complaint kind of gets made. So that's where we probably now need to dig up evidence. I mean, like Saza said, in a country like Singapore, almost 100% educated, you still can't have a law, and you still have authorities looking the other way. Our countries still have a long way to go, but that doesn't mean we shouldn't start.
That's right. That's right. Thank you so much, Dr. Nozer. And I'm going to come back to you. Since Anjali is not here, there is a little gap that we have. I have some more questions, but for now, I will move on to Ibu Atas. Ibu, thank you for joining us. Ibu, you have been one of the few strong voices out of Indonesia. and you have firmly stood against the practice, and you have become synonymous with the slogan, "Do not touch our genitals." As per the 2018 research done by the Indonesian National Commission for Women, there is an 85% prevalence of FGM in Indonesia. We are in 2022 at the moment. And as per the SDG goals, we are supposed to eliminate FGM by 2030. We're just 8 years away from that. Do you see that happening? I mean, as a woman living in Asia, do you think that goal is anywhere close? Because just until recently, there was really no, open acknowledgement or any kind of research. And even now, we don't have research done on the continent, on the Asian continent, right? So we were not existent in that sense. So what do you think are the steps that need to be taken in order to accelerate this issue and, kind of make sure that it is in fact stopped by 2030? So if you could just talk about that.
Yes, thank you, Insia, for your questions. So may I close first my camera, because, okay. Thank you, Beth, for Sahiyo, for inviting me. Maybe I am the longest advocate for stopping FGM in Indonesia, because at the time we started at the Department of Women's Studies at the University of Indonesia, and there after ICPD, 4 of my colleagues went to ICPD Cairo in 1994, and so then that was the moment that we saw that the first time FGM was mentioning. And so we started starting with our research. It was just a small research among us, among the lecturers, and we made a picture of our own genitals, and nobody knows actually what, because we printed out, it was in 1995, print out, and nobody knows whose genital is on the picture. But we know that many of us were cut. So that was the first awareness raising. And then finally we found a donor, a population council, and we did in 8 provinces, actually just one community in each of the 8 provinces. And we saw that many of them, that was in 1996, 1990. So that was all the first data. And then finally, we go in to the Ministry of Health, because at the time we has already close relationship with the Ministry of Health, and we had a series of with the topic about FGM, that we are so concerned, because people knows at the time we have 250 million people, and every year 4 million babies were born, and 85% of them are right after they were born, they were circumcised. So that's why we are coming again and again as lecturer and as researcher, showing them, please do something. So, and then because in Indonesia, we have Ministry of Religious Affairs. So at that time, we thought that maybe it is better that we ask them to join. So, and from them, we heard for the first time that in some islands who never heard about these practices, And who brought these practices were the midwives, because we have 300,000 midwives from the academy, the midwifery academy. So they was the one who brought the practices to other islands from Java. Yes, so then we asking the Association of Midwives to join with the Ministry of Health to stop. But it is so difficult because it's already spread out. The midwives started performing FGM since the 80s. So that's why, and until now, we are as advocates, we are coming from university as advocates, but more and more civil organizations, the CSOs, are against and campaigning for stopping these practices. But back to the Ministry of Health. So we are working not just with the Ministry of Health, but also with the Ministry of Women Empowerment and Child Protection. Yes,
Right.
And the Ministry of Religious Affairs. And then we spread out over the country where all the civil society organizations are involved too. Universities are involved now. And of course, because it is also a religious matter, so who are very active are the female mufti, female ulamas. Yes, in 2017, we are succeeded. So that's why a lot of female activists from Malaysia attending this big congress, where we are saying that as female ulamas, as female muftis, we cannot take no action. We have to stop this female genital mutilation, they call it circumcision. First of all, what happened now since the COVID, the medicalization is growing because people couldn't go straight to face to see a doctor. And what they are doing now, the doctors, I just finished last year in July, a study in Jakarta and other 4 outskirts cities, outskirts surrounding Jakarta. Jakarta alone has 10 million people, and the surrounding 4 surrounding outskirts are also about 10 million. So we did the study, and that is where the medicalization happening now. And we were shocked. I'm as a researcher, I was shocked that through the website, I didn't know before that those doctors promoting today, the last 2 years, because there is COVID, through websites. And so we sent our research assistant to those addresses. And they have their billboards. They have just their billboards, and the Ministry of Health doing nothing. And as you know, it was stated at Beth's flyer also, you just showing us that actually in 2014, actually in 2010, the female Ministry of Health launching that midwives cannot perform female genital mutilation and should stop. But then the Ministry of Health got a lot of letters from the religious groups. They are saying that you cannot, as a Ministry of Health, prohibited our tradition and our religious compulsory, they call it compulsory, in the Quran. While I'm the one who, since 1994, are in a Muslim group where Mrs. Sinta Nuriyah, our former president, she is one of the, we call it the champion, champion against female circumcision. So we bring her all over the country because she's the one who are so against. And of course, now we have the female ulamas who became bigger and bigger, and they're campaigning through the not just social media, but also on TV, because we have a lot of TV channels. So people now campaigning more and more to stop this practice. But again, people know that Indonesia has two big Muslim organizations since the colonial period. The one is against female circumcision, but the other one is just broken in two groups. The one is still thinking that it is compulsory. So that is and there is a third group. A third group, we call it that Muslim group became later after the fall of Suharto, and they are we call them the extremists, because they are very right wing that women has no say, and all the misogynist narratives. So I think it is such a big first in SIA. I can say that in 2030 it will not happen, but we tried with the new generation, the youth. Right. So Saza, we are so happy having you, and we have more and more people like you. And beside the younger generation, we have the female ulama who are very young. So we are working with them, and of course there is also campaigning at the community-based actions at the several community. What I said that there are several groups. So the Nahdlatul Ulama is all are against the FGMC, but this other Muhammadiyah is still divided. And then right. the third group, we call it the extremists, and they're really saying that it is needed for girls because about the extramarital affairs, because we are now since the last 8 years, they're trying through the parliament to change our penal code, and even that they are saying all those paragraphs about how to stop extramarital affairs. So about the term.
Basically, it all boils down to women having extramarital affairs, right? I mean,
yes,
it's just about that premarital sex,
even in the penal code. So we as activists have a
Ibu Atas, I am really enjoying the conversation with you, and I'm sure our audiences are, but unfortunately we do not have much time, and I still have a few questions that I want to come back to the panelists with, and also I have some questions from the audience. So there is something that I have been wanting to ask all the panelists here, and please, if you can briefly just give me your opinions on this. So when we talk about our bodily privacy, when we talk about our body rights, even in the context of children, we hear a lot of arguments happening about consent, especially when it comes to children, right? And there's always an argument saying that a parent knows best. So this argument is most of the times used in the context of FGC. I would like to ask each one of you out here, what do you all think when it comes to consent, when it comes to FGC? Is this the same? I mean, we have been given excuses like, oh, but you pierce your child's ear, yes, you take them for vaccinations, you don't ask them for their consent. And it kind of, puts you in a tough spot sometimes, because I know for a fact that this is not benefiting the child, right?
Mhm.
But I would like for you to give your opinion. So maybe we can start with Dr. Kalpana. Doctor, you're mute. You're on mute.
Can you hear me now?
Yes.
Okay.
Yes.
That is a can of worms you just opened about consent. Now, let's look at how we can equate the different procedures that you mentioned. There are some procedures which are meant to save a child's life. As a neonatal surgeon, those are the procedures that I have often had to perform. And I know that the consent then from the parent, obviously a newborn cannot give consent. Consent is from the parent, and the purpose is to save the child's life. That's number one. Number two, it is to increase the functionality of a particular organ, which means that a procedure which will improve the function or even the appearance. Appearance is often part of function, like a facial defect. There again, a parent is giving consent to protect the child and make sure that the child's life is enriched and normalized. In the same category, I'm going to quote an example, which again may be too complex for understanding in a short period, but I'm going to mention it just the same, is how thinking has changed over the last 20 years. And that has to do with the question of babies who are born with genitals which are ambiguous. That means you can't make out when you examine them whether it is a male or a female child who has been born. And years ago, it was a common practice to assign a gender to the child. The doctor would advise the parent that this is the state, this is what the child has, 1, 2, 3, under different categories of understanding like genetics, function, internal appearance, internal organs, and the parent would make the decision of what is best suited in her or his opinion for the child. So here also the parent was making a very informed decision as a guardian to the child. But the doctor there, in my opinion, was at fault. This is something that I used to rebel against when I was a resident so many years ago. And I'm so happy to see that now, after fighting a long and arduous battle all over the world, people who have intersex are in a position where they are allowed to live their lives as they wish. And the gender of choice is also left to them after the age of puberty and development. So you see now here how consent has changed over the last 25 years. But when you equate, say, a vaccination to a procedure, it's not the same, because a vaccination is considered universally protective against a disease, endangers the health of the child. When you come to piercing of the ears, I regard it as a very wrong procedure. I regard any unnecessary touch on the body of a child, which is not guaranteed by a menace to the child's integrity and well-being. Such a procedure, even if it is piercing the ears, I regard it as wrong. So if I'm asked to perform it, I will not perform it, preferably. I will not perform it. Okay? But you cannot, finally, the function of the earlobe doesn't change by piercing it. Nothing, there is no injury which is caused to the child, apart from the fact that you are interfering with the bodily integrity, which in itself, in principle, is wrong. And surely she can pierce herself in multiple places after she's a teenager and she's welcome to do it, again, if she's properly informed. There is no comparison between this and FGM. No comparison at all.
Thank you so much, Dr. Kalpana, because it's really amazing. I love the way you put it. And I would like to take this to Dr. Nozer. Dr. Nozer, what do you have as an opinion in terms of consent?
I think Kalpana has just said it very well, and she's probably spoken for all of us. And let's face it, yes, there is consent when you need to give consent, and parents give consent for their children up to the age of majority for justifiable medical reasons, where there is definitely evidence of benefit. Something like piercing the child's ears, yes, it's practice, but technically minimally harmful. But is it really consent when it comes to something like cutting or FGM? Or is it just something that's unquestioning following of a practice or a diktat? Is someone really thinking? Is someone really counseling? Is someone really talking about consequences? Because like I told you about my patient the other day, where is anyone thinking? And if it was also above ground and consented, then why is it done so quietly, very often on the sly? Even if doctors are doing it, why is it on an operation theater list? There is absolutely nothing medical about it if it's done by a medical practitioner, and most times it's not done by a medical practitioner. So it's a sham consent. Of course, when you are up against the kind of, traditional monolith that you are taking on, there will be every possible argument, every clever argument in the book used to justify what is done. But at the end of the day, it is just unquestioning, unthinking, following of a practice. And let's face it, that's how it works. And that's how people are forced to behave when tradition steps in. So there is no consent. When consent happens, consent has to be informed. Kalpana said that before. Consent has to discuss pros and cons. Consent has to make the person understand all the negative consequences of a procedure. Consent has to be signed. Consent has to be witnessed. None of that happens. So this is not consent. This is a sham consent. I wouldn't even call it consent at all.
Right. So we are obviously, out of time. There's not much time to take this discussion forward with the panelists, but I do have a few questions, and we have time for just one question. So I'm going to ask that, and I'm going to apologize to the audience. I'm very sorry that we cannot take all the questions, but I'm inviting you, and you are welcome to send your questions to info@sahiyo.com, and we would like to respond to you. Saza, you want a minute? Please go ahead.
Sorry, I just wanted to respond to your question, and I think thank you, Dr. Kalpana and Nozer, for sharing the fundamental perspective. I also think that one big problem with FGC is that it's irreversible. Granted that there is clitoral reconstruction that is shared in the chat, but much of it is irreversible. I think that's one big problem. And then secondly is that a child can always choose to do it when they are older, when they are above the age of consent of 18 or 21 if they want to. And most often the argument for, why not wait till a child can give consent for this practice, right, is that the parent will say, oh, because then the child wouldn't do it, because then it'll be painful. Then that's exactly the point, right? If it's going to be painful, then why are we doing it to a child? And I think people have the misconception as well that babies cannot feel pain, which I think the doctors here will tell you that that is categorically untrue, and that the mind might forget, but the body always remembers. The pain is stored within the body, and it comes out in the form of trauma later on. Yeah.
Very good. I
Insia.
agree.
Uh,
Yes, yes, Ibu
please,
Atas.
just 1 minute. I
Sure,
forgotten
sure.
to tell you about the later after 2010, the female Ministry of Health issued a decree to
Okay.
stop the FGMC. But what happened in 2014, because she passed away at the time, and another female minister came, and then she put in a new decree where it is possible that just using a needle, because what happened, the religious groups asking that to be that the circumcision is be accepted, it should be just a pin of blood should be
Oh,
showing. Yes, and we were so shocked. And what is happening until now, that was then they're still using the needle to get just a spot of blood. So, and Dr. Kalpana and Dr. Nozer, you as doctors can...
6 o'clock.
Yeah, no, exactly,
Right.
but they can
Thank you. Thank you so
give
much.
the,
I mean,
the consequences, the medical consequences, because they just always said it is just a pin of blood
a
or
pinch of skin, yes. In
of
fact,
skin.
Sahiyo's other
Mhm.
co-founder, Priya Goswami, who's also a filmmaker, she has made 2 films on this, and one is called Pinch of Skin, and the other one was not just a pinch of skin or not just a cut, I think, right, Priya? I'm not sure if I'm quoting the second one right, but so I just want, I mean, we
it
don't
is
have
so
time.
dangerous. It is so dangerous for Indonesia because all the midwives who I said there are 300,000, so half of them still using the needle.
Yeah.
So for me as a feminist activist, that's why I said don't touch our genitals. Don't
Absolutely.
touch our genitals. Yeah, that is the most we
Yes.
should using that. Don't touch
I
our
agree.
genitals.
I agree totally, because here in India as well, there are different kinds. I mean, there is the rubbing that happens. There are solutions that are put on the clitoris. No one knows what those solutions are.
Yes.
There is
Yes.
a prick. There are
Betadine,
needles,
we are
there
using.
is rubbing. There are all
Yes.
sorts of things happening in the name of FGC.
Yes.
Anyways, I need to wrap this up.
Yeah.
We just
Okay.
we have an exit poll that is going to be put up, and I would love for all of you to fill it out. There is one question that I would like for one of you panelists to just, if Dr. Nozer or, Dr. Kalpana, if either of you can answer this. It is about FGC being interrelated and always linked with hygiene. As a doctor, please, I mean, I beg of you, please put it out here. I have done it in the past. I would love for you guys to, talk about that.
Would you please take the whole thing? Not the...
So,
FGM is equated with what?
With hygiene.
With hygiene? I didn't hear that. It's a non-starter, the question.
I know, but that's exactly what it's, when it's talked about, that's what it said, that it's done for hygienic reasons. So
Insia, that is again, and I don't think we want to get into this at the end of the program because our focus is on FGM or cutting, is to try and have a parallel with male circumcision. And there's a long history of people trying to justify the benefits of male circumcision and claiming that it tends to contribute to hygiene, which has completely been disproved. So at one point in time, it was male circumcision, less HIV, less STIs, less CS cervix in the female population of the community, and none of that was borne by scientific research. So you can teach a person to be hygienic and clean. FGM is not circumcision. There is nothing that you're opening up or clearing or creating a space where you will have more hygiene. So it's the most outrageous excuse or justification to do something and thereby say that the majority of the world's population who does not practice this very archaic thing of brutalizing young girls is not going to be able to manage hygiene. So, I mean, it's completely, like Kalpana said, a non-starter. I think these are all arguments which are pulled out of the hat to justify something which is not justifiable. And I've also been looking up a lot of stuff where the proponents keep going back to male circumcision, and there are articles in the BMJ. There's a lot of discussion there, and maybe people should go and use it. And maybe at some point in time, I know that's not for us to say, but there are people who also suggested that maybe when it comes to males as well, there should be an element of choice after a certain age when they can make the choice. But let's leave that discussion for another forum, another day.
Well, I just got a request from one of our co-founders, Priya, saying that there should be a part 2 of this webinar talking about this, because it is an interesting insight. And there are a lot of men out there who always pose this question to us, that how come you all don't do anything about male circumcision? And my answer is always this, that you start it and we will support you if you want our support. So, I mean, on that note, I want to thank everybody for attending this webinar, for supporting our cause, for showing interest. I see a lot of activists have also been on this webinar, and just keep up the good work. We have a long way to go. It's an uphill battle, and but we have some good people on our side. And thank you, Dr. Nozer, Dr. Kalpana, Ibu Atas, Saza. Thank you for whatever you are doing to help us and help this cause. And all the best. And I hope this year sees a lot of good things. And I hope there's some big activity happening around FGM on the 6th of February, which is the Zero Tolerance Day for FGM. I hope we all are able to make a big noise across the world. So thanks a lot. And I'm going to hand it over to Beth. She's going to wrap it up for us.
Thank you, Zia.
Thank you so much all for coming. I hope you found it interesting and informative. And of course, thank you so much to all our speakers, all bringing in such interesting perspective. And we know that I learned so much from it. I'm sure other people did. And thank you also to Insia for moderating. It's brilliantly moderated, also putting in her own insights. That's brilliant. Thank you, Insia. So what we're going to do, we're just going to leave this open for 5 minutes or so, just for people to finish their comments. And also do let us know if you have any more questions. Like Intia said, I'll put it in the chat again. You can email us at info@sahiyo.com, and we will try and get back to all of your questions that you may have with answers. And this is, we've got on the screen, is our brand new website. It's our homepage for the new Sahiyo website. So please visit us, visit the website. We have so much information on there, so many blog posts and writings from survivors and experts. And yeah, there's so much to learn from it. So yeah, thank you all for coming. There will be a part 2 at some point, which obviously we'll advertise. So thank you very much, everyone.
Thank you.
Thank you. Thanks, Beth.
Bye.
Thanks a lot.
Bye.
Bye. Take care.